Usually, like when we think of anti-aging or tissue regeneration, I feel like we always picture the face.
Oh, definitely. It's all the serums, lasers, dermal fillers.
Yeah, the whole routine. And it's all right there, front and center. It's super visible to the world, and people discuss it completely openly, on social media or even just at dinner parties.
Right. It is entirely normalized now.
Yeah.
People trade tips on their skincare routines or talk about preventative Botox without even a second thought.
Exactly. But the moment the conversation shifts below the belt, the silence is just, it's almost absolute.
It really is. Historically, women were just expected to deal with those changes quietly.
Yeah. But today, we are going completely off that highly visible map. We're heading into this rapidly growing and honestly sometimes controversial world of intimate wellness and vaginal rejuvenation. Okay, let's unpack this because we have a massive and frankly wild stack of sources today.
We really do.
Yeah, we are looking at everything from like glossy aesthetic clinic brochures to really deep clinical data like the 2019 Palmieri medical study.
Right, and then contrasting all of that with some very stringent, very cautious guidelines from places like the American College of Obstetricians and Gynecologists
Yeah,
and the Mayo Clinic.
exactly.
Yeah.
And the contrast in those sources perfectly highlights the complex intersection we're exploring today. Because what we are really looking at here is a biological problem colliding with a mechanical problem.
Which is such a fascinating way to frame it.
It is. And right into that collision, you have aesthetic clinics stepping in, offering these highly advanced regenerative solutions to issues that honestly have just been brushed off as a normal part of aging for generations.
So our mission today is to cut right through all that marketing jargon. We really want to separate, surface hydration from deep structural changes.
Right, getting past the buzzwords.
Exactly. Specifically, we're focusing on this battle of the injectables, polynucleotides versus hyaluronic acid fillers.
Which are completely different things, functionally. Totally. So whether you're navigating menopausal changes or you're dealing with postpartum recovery, or honestly, if you're just insanely curious about the frontiers of regenerative medicine, understanding what these treatments actually do and how they differ is absolutely key to making informed, empowered choices about your own body.
Absolutely. But before we even look at the syringes and the high-tech gels, we have to establish the biological baseline.
Right, like what's actually happening down there first.
Exactly. We have to understand the physical environment these products are being injected into and why anyone would seek out these clinical treatments in the first place.
Because, you don't just wake up and decide to get an injection in such a sensitive area for no reason, right?
Definitely not.
According to the Mayo Clinic sources, it usually starts with something called genitourinary syndrome of menopause, or GSM.
Right, which older medical literature actually used to call vaginal atrophy.
Yeah. And the biology here is essentially this massive cascade effect, and it all starts with a drop in estrogen.
Estrogen is really the architect of that specific tissue. So when those hormone levels drop, and that could be from menopause or certain breast cancer treatments or even just postpartum shifts, the vaginal epithelium, which is the tissue lining, gets physically thinner.
It just loses its architectural support.
Exactly.
So to picture this mucosal thinning, I like to think of a thick, wet sponge. Like when it's fully hydrated and supported, it's bouncy, it's elastic, you can squeeze it and it bounces right back.
That's a great analogy.
But if you leave that sponge out in the sun to dry over time, it shrinks. It becomes super brittle. And if you try to bend a dry sponge, it doesn't bend, it just cracks and tears.
Right, and that structural change triggers an entire ecosystem shift inside the body.
How so?
Well, without that robust estrogen supply, the pH level of the vagina actually rises, so it becomes much more alkaline.
Okay, and alkaline is bad in this context.
Right, because a higher pH creates a really hostile environment for lactobacillus bacteria.
The good bacteria.
Exactly. Those bacteria are the natural guardians of that environment. They produce lactic acid to keep infections at bay. So when the lactobacillus population declines, natural lubrication just plummets.
Wow. Which brings us directly to the mechanical problem.
Right.
Because you now have this delicate, thin, dry tissue, our brittle sponge, and then you introduce just everyday mechanics.
Just normal life.
Yeah. Friction from walking or cycling or sexual intercourse. The sources actually describe the resulting microtears as a literal paper cut feel.
Ugh. Yes.
which sounds agonizing. It causes intense itching, burning, and dyspareunia, which is the medical term for painful intercourse.
Yeah, and that kind of chronic pain, I
Yep.
mean, it affects a person's quality of life, their intimate relationships, and just basic daily comfort.
Yeah, just walking around would be miserable.
Completely. Now, the medical establishment is very clear on the protocol here. You do not jump straight to needles.
Right, no injectables yet.
No. You always start with foundational therapies to address that baseline environment.
So the first line of defense is just basic, non-hormonal vaginal moisturizers.
Exactly.
And these aren't just for immediate sexual activity, right? You use them maybe 2 to 4 times a week just to establish a baseline of hydration.
Right, to allow the tissue to actually hold on to moisture again.
And then there are lubricants specifically for sex, but even there, you kind of have to know your chemistry.
You really do.
Like water-based lubes are versatile and safe for condoms, but silicone-based gives a longer glide because they don't, absorb into the skin as quickly.
Right. And oil-based feels rich, but the sources explicitly note it will rapidly degrade latex condoms and toys, so you had to be careful there.
Right. Okay, so if those over-the-counter options aren't moving the needle, what's next?
The next foundational step is local low-dose vaginal estrogen, or DHEA.
Okay.
This is applied directly to the tissue. The goal is to biologically signal the local cells to thicken up again.
To restore that mucosal elasticity.
Exactly, but without flooding the entire body with systemic hormones.
So if we already have moisturizers and local estrogen, why is there this booming industry for injectables?
Well, it's important to note that the clinical guidelines emphasize that everything we're about to discuss, the polynucleotides, the fillers, they are considered adjuncts.
Meaning they're add-ons.
Right. They are optional add-ons meant to be used only after you have addressed that dry sponge baseline. Skipping the foundation means the advanced treatments just won't have a healthy environment to work in.
So you have to fix the soil before you plant the seeds.
Exactly. But some patients try the moisturizers and the local estrogen, and it is simply not enough to fully heal the tissue.
The microtears just persist.
Right. And that is where aesthetic clinics step in, offering what they call skin boosters to heal that surface tissue. And the star player in this category is polynucleotides.
Okay, here's where it gets really interesting for me, because when you dig into what polynucleotides, or PNs, actually are, we are talking about bioactive molecules made of highly purified DNA fragments. And the source of this DNA, I was reading this, and the brochures just casually mention it, is derived from the sperm cells or gonads of salmon or trout.
Yeah, that catches a lot of people off guard.
I mean, I have to pause here. We are literally talking about injecting fish DNA into the human vagina to fix dryness.
Yes, we are.
How on earth does applying fish DNA actually translate to human tissue repair? I mean, it sounds like science fiction.
What's fascinating here is that it sounds completely bizarre on the surface, but the underlying mechanism is actually brilliant.
Okay, tell me how.
Well, first, PNs are not fillers. They don't just sit there and take up space. They are biostimulators.
Biostimulators.
Right, and the DNA from the salmon sperm is highly purified, meaning all the proteins that could cause an allergic reaction are totally stripped away, leaving only the raw nucleotides.
And nucleotides are just the universal building blocks of all DNA, right? Like whether
Yeah.
you are a human or a fish.
Exactly. They're just the raw materials. So by injecting these fragments superficially into the tissue, you are delivering a massive payload of raw building materials directly to the local cells.
Wow, okay.
This completely streamlines the metabolism of the connective tissues. It specifically targets and stimulates the fibroblasts.
The cellular factories.
Right. Fibroblasts are the factories responsible for producing structural proteins.
Yes.
So the nucleotides basically wake these factories up, prompting them to churn out fresh collagen, specifically types I and Ti as well as elastin.
Oh, that makes so much sense.
Yeah, and beyond the structural support, PNs act as a really powerful antioxidant. They clear out free radicals and calm down that low-grade inflammation that's constantly irritating the tissue.
So it's not adding artificial bulk at all. It is essentially tricking the body into repairing its own dry sponge.
That's exactly it.
I was looking at that 2019 exploratory study by Isabella Pia Palmieri in our sources. And frankly, I was super skeptical at first. Like, did injecting fish DNA actually work for the patients they tested?
The data is actually quite striking. They took 19 postmenopausal women who were suffering from severe GSM symptoms.
Women who are likely just desperate for relief from that constant paper cut friction.
Right, and they administered priming injections of salmon trout polynucleotides.
Okay.
The dosage was 40 milligrams in a 2-milliliter syringe, and they injected it superficially into the mucosal tissue over a series of sessions, spaced out over a few weeks.
And what did the timeline of the results look like for those 19 women? Was it a long process?
No, it was incredibly fast. By day 35, the symptoms of itching, soreness, and that awful tingling had dropped by over 50% compared to their baseline.
Wow. Over half in just over a month.
Right. Just think about living with constant irritating friction, and a month later, half of that pain is just gone. And then by day 90, dyspareunia, the severe pain during sex and overall vaginal dryness, had fallen by about 59%.
That is just a massive measurable improvement in quality of life.
It really is.
It totally shows that by using biostimulators, you can actually restore surface hydration and elasticity.
Yeah.
But I'm looking at these clinic brochures, and a lot of these patients aren't just complaining about surface friction.
No, they're not.
Yeah, they're talking about a complete loss of structural volume. Like after significant weight loss or natural aging or childbirth, the labia majora, the outer lips, can actually lose their fat pads and physically deflate.
Right.
And polynucleotides can't fix a deflated structure, right?
They cannot. Polynucleotides repair the tissue quality, but they do not add bulk or change the anatomy.
Okay, so that's a different tool entirely.
Exactly.
Yeah.
If a patient is dealing with a loss of structural volume, that is where hyaluronic acid fillers or HA fillers enter the conversation.
Got it.
But we had to make a really vital distinction here that the scientific literature emphasizes. There is non-cross-linked HA, which is basically a watery substance used superficially just to attract moisture.
Okay.
But when we talk about HA fillers, we are talking about cross-linked hyaluronic acid.
Wait, what does cross-linking actually do to the acid? Like, what's the difference?
Cross-linking acts as a chemical scaffolding. It essentially links the individual hyaluronic acid molecules together, so they form a thick, cohesive, viscous gel.
Ah. Okay.
Because the molecules are bound so tightly together, the human body's natural enzymes can't break the gel down quickly.
That makes sense. It's like if treating the vagina is like renovating a house.
Okay, I like this.
Polynucleotides are the plaster and the paint. They're repairing the surface of the walls, making them smooth and elastic and protected. But HA fillers are the actual scaffolding and bricks. They are physically changing the shape and the volume of the room itself.
That is a perfect way to look at it. These cross-linked fillers are injected into much deeper planes of the tissue, specifically to add structure, contour, and bulk.
And aesthetic clinics often market this as labial puffing, right? To
Mhm.
restore that lost volume to the labia majora.
Exactly. And because of the cross-linking, the results typically last anywhere from 6 to 12 months before the body finally breaks the gel down.
Which is a pretty decent amount of time.
It is. And the applications go beyond the labia, too. The sources note fillers are actually used to increase penile girth in men.
Oh, wow.
Yeah, and there is also the G-shot, where a filler is injected into the anterior vaginal wall to temporarily amplify the G-spot. The idea is to attempt to enhance sexual sensation by making the area more prominent.
But changing the structure of the house carries completely different risks than just painting the walls, right?
Oh, absolutely.
Because these fillers are thick and because they're placed deep, if a practitioner places them incorrectly, the complications can be disastrous.
Very much so.
The medical sources highlight risks like contour irregularities, which basically means, lumpy asymmetrical tissue, or even nodules and granulomas where the immune system actually attacks the filler, viewing it as a foreign invader.
Right, your body just rejects it.
Exactly. But the absolute worst case scenario they warn about is arterial occlusion.
And arterial occlusion is a severe medical emergency. The vascular network in the vulva and surrounding tissues is highly complex and incredibly densely packed. So if a needle accidentally punctures an artery and injects that thick, cross-linked gel inside, the filler acts like a dam.
Oh, that sounds terrifying.
It completely blocks the blood flow.
Yeah.
Without oxygenated blood, the surrounding tissue just begins to die off, which leads to necrosis.
Which is just awful. And it brings up a really critical clinical nuance regarding why someone is seeking treatment in the first place.
Right.
Let's go back to our patient with genitourinary syndrome of menopause. If her pain is entrance-focused, meaning she feels that raw, paper-cut friction right at the opening of the vestibule, a bulky HA filler seems like a terrible idea.
It is entirely the wrong tool for the job.
Yeah, because injecting a thick filler into an area suffering from mucosal thinning won't solve the surface friction issue at all.
Exactly. By adding rigid bulk to an area that has already lost its elasticity, you are actually increasing the mechanical pressure.
It could make the pain and tearing much worse during intercourse. Like you wouldn't fix a dry, brittle sponge by shoving a brick inside it. You just stretch it until it tears.
Right. But clinics, however, are constantly looking for the next big advancement.
Mm.
And now we are seeing a shift toward this synergy approach.
Right. Combining them.
Exactly. If polynucleotides fix the surface and HA fillers fix the structure, they are starting to mix them together. We looked at a specific product in the sources called Nugen as a prime example of this biohacking trend.
Yeah, and Nugen is a fascinating formulation because it attempts to tackle tissue degeneration from multiple angles simultaneously.
It really does.
It's an injectable gel that combines polynucleotides, non-cross-linked hyaluronic acid, and a third crucial ingredient, mannitol.
It's the triple threat.
Yeah, you have the PN, the fish DNA fragments, going to work stimulating the fibroblasts to build new collagen.
Right.
Then you have the HA providing deep, immediate hydration to the tissue. And then the mannitol acts as the bodyguard for the entire operation.
And mannitol is really the element that elevates this from just a simple mixture to a real biological hack.
How does it work as a bodyguard exactly?
Normally, when you inject non-cross-linked hyaluronic acid, the body's natural enzymes, which are called hyaluronidases, they attack it and break it down very quickly.
Oh, so it wouldn't last long on its own.
Right. And free radicals in the inflamed tissue also degrade it. But mannitol is a potent antioxidant and water-binding agent. It essentially acts as a shield, neutralizing those free radicals and protecting the hyaluronic acid from enzymatic degradation.
So it buys it time.
Exactly. This allows the hydrating effects to last significantly longer, giving the polynucleotides the time they actually need to rebuild the cellular structure.
Which is a brilliant paradigm shift, at least on paper. You regenerate the tissue while instantly hydrating it, and you protect the hydration so the repair actually holds.
Right.
But when you zoom out from the glossy aesthetic clinic brochures and look at the major medical institutions, there are severe documented reservations about this entire industry.
There really are. The American College of Obstetricians and Gynecologists, or ACOG, has issued statements that do not mince words.
They did not hold back.
Not at all. Their 2007 committee opinion specifically targets the very terminology driving this industry, calling out marketing phrases like vaginal rejuvenation, designer vaginoplasty, and revirgination.
And ACOG's stance is pretty unequivocal. They state that these cosmetic procedures are just not medically indicated.
Right.
They emphasize a severe lack of robust, long-term scientific data supporting their efficacy. And they point out that surgery or invasive procedures in this highly sensitive area carry very real risks.
Major risks. Chronic infection, severe adhesions, and scarring that can actually alter the anatomy and make intercourse permanently painful.
And the FDA has also issued stringent warnings, specifically regarding energy-based devices, right?
Yes. Before injectables became the big trend, lasers and radiofrequency tools were heavily marketed for vaginal rejuvenation.
Okay.
But the FDA cited reports of severe burns and chronic pain. The mechanism behind that pain is alarming, honestly. Aggressive thermal damage from a laser can misfire or permanently damage the dense nerve endings in the mucosal tissue.
Wow. So what does this actually mean for you listening right now? You might be looking at this rapidly evolving industry and seeing a massive tension.
There is definitely a tension there.
On one side, there are women suffering from debilitating GSM symptoms, dealing with daily pain, looking for genuine relief when over-the-counter moisturizers just fail.
Right.
But on the other side, there is this massive marketing machine pushing the concept of designer vaginas, which frankly feels like it's preying on body image insecurities and medicalizing normal human aging.
If we connect this to the bigger picture, impartially speaking, the clinical landscape is balancing two realities right now.
Okay, what are they?
Well, the clinical data, such as the Palmieri study we talked about, demonstrates that women are finding very real, measurable symptom relief from biostimulators like polynucleotides.
Their biological function and the quality of life are significantly improving.
Exactly. But conversely, the medical establishment is urging extreme caution because the long-term safety data for many of these newer injectables simply isn't robust enough yet.
Right. And the idea that a 60-year-old vulva is supposed to look and function exactly like a 20-year-old vulva just completely ignores natural anatomical diversity.
It really does.
It creates a complex about a perfectly healthy, albeit aging part of the body.
And that's really the core of ACOG's warning. It's about prioritization. Are we treating a debilitating medical symptom, Or are we surgically chasing an aesthetic standard that was basically invented by marketing departments?
That's the real question. So, to quickly recap our deep dive today, we are looking at a landscape where the treatments are as varied as the symptoms themselves.
Very true.
If the primary issue is surface repair, elasticity, and healing that awful paper gut friction, polynucleotides, our salmon DNA biostimulators, act as the plaster and paint. They regenerate the tissue from the top down by stimulating cellular repair.
Right.
But if the issue is a deep loss of volume and structural deflation, cross-linked hyaluronic acid fillers act as the scaffolding and bricks to recontour the anatomy, though they carry heavier risks like arterial occlusion.
Exactly.
Mm-hmm.
And the golden rule established by the medical sources remains constant through all of this.
Yeah.
Any intervention must start with the absolute basics.
Right. Don't jump straight to the needle.
Never. Scheduled non-hormonal moisturizers, appropriate lubricants, and a thorough consultation with a qualified medical professional to rule out active infections or other underlying conditions.
And the goal should prioritize function, health, and physical comfort over some culturally constructed aesthetic myth.
Exactly.
Which kind of brings us back to where we started. We used to just look at the face when we talked about reversing the clock.
Right.
But now we are using highly purified fish DNA fragments and protected acids to literally rebuild the biological foundations of our most sensitive, intimate tissues.
It is undeniably incredible science.
It really is. But it leaves you with a pretty profound question to ponder on your own. If regenerative medicine can now allow us to virtually remodel any part of ourselves, seen or unseen, where exactly does the line blur between necessary, empowering medical healing and the relentless, exhausting pursuit of an ever-youthful human body?
That is a question science cannot answer. We really have to determine that boundary for ourselves.
That's at least something to think about. Until next time.